Okay, so this is the last lecture for this entire unit. There's not much in each section, so I combined everything, even though I have your um, mobility for next week. All I'm really covering on it is the Parkinson's, so I added it on the end of this. So this is your last lecture, even though there's another little PowerPoint that I might address in this section. So let's get into it. So we're going to talk liver with hepatitis. It's not going to reverse or slow the process. We're just treating the complications of cirrhosis. So spironolactone, which is a potassium-sparing diuretic. I gave you the page number there for carts to reduce fluid retention in ascites. Spironolactone, being potassium-sparing, it works doesn't work as good as loop diuretics. Sometimes it's used in combination with the loop diuretics, especially if they end up with ascites. So just for cirrhosis of the liver, they're going to give spironolactone. Remember with potassium, the potassium sodium pump. So when you're retaining the potassium, you're losing sodium. Adverse effects of spironolactone are hyperkalemia or elevated potassium. You want to instruct them to avoid potassium-rich foods such as avocados, bananas, broccoli, cantaloupe, dried fruits, nuts, beans, prunes, pecans, spinach, tomatoes, potatoes, sunflower seeds, and watermelon. And some side effects of spironolactone are dizziness, headache, drowsiness, rash, cramping, diarrhea. And because it works with an agonist of aldosterone, you can have hirsutism, gynecomastia, deeper voice, and irregular menses. I'm trying to see if there's anything else. Okay, so then next we have your lactulose, which is a laxative that's not absorbed. It can be given orally down an NG tube through the gut or per rectal tube. If the person's comatose, you're going to do, sometimes you'll have to do it in the rectal tube. It's pretty gross. Anyway, it's given for hepatic encephalopathy to pull the ammonia levels down. It also inhibits intestinal ammonia production. If the lactulose changes into a lactic acid in the colon and decreases the bacteria production that causes ammonia, whilst also pulling the ammonia out when the bowels go. Of course, it's going to cause diarrhea. Can also lead to some malabsorption. Watch them for fluid volume deficit or hypovolemia. Also watch for ileus, electrolyte imbalances. Anything else on there? What do we have? Your neomycin, which Karch talks a little bit about, page 103. Now, neomycin is given for the bacteria in the gut because when you have bacterial growth in the gut, that increases ammonia level, which worsens your hepatic encephalopathy. So you want to keep the bacteria out of the gut. Now, neomycin is an aminoglycoside, so you have to watch for the potential side effects of diarrhea, malabsorption, and the big things with aminoglycosides are ototoxicity and nephrotoxicity. So you're watching their hearing and their renal function. The text didn't go into it, so I'm not going to go into some changes that we're making because of the possible side effects with the neomycin. So other things that are used are beta blockers. Oh, sorry. I guess I typed Netalol and I left off the other, which would be propanolol, which are two non-selective beta blockers. Those are used to keep the hepatic portal pressure down. They decrease cardiac output and constriction of some of the GI circulation, which leads to a decrease in portal pressure. Increased efficacy and decreased adverse effects is when it's combined with a long-acting nitrate, such as listed here, which is your isorbide mononitrate. So with your non-selective beta blocker, it blocks the beta 1 and the beta 2, but when it's blocking the beta 1 receptors in the heart and the vascular smooth muscle, that's how it decreases the portal hypertension. So you're also watching for bradycardia, dizziness, and especially bronchospasms. And you need to remember contraindications for beta blockers, like an asthmatic or respiratory issue, because it's non-selective. Your nitrate, isorbide mononitrate, is a nitrate. You should remember that it's a vasodilator. That's how it decreases portal pressure. The main side effects for isorbide are headaches and nausea or vomiting. Ferrous sulfate, folic acid, you know about your iron, you know about your B vitamins. Ferrous sulfate, constipation, they do give the ferrous sulfate enteric-coated for this use. I'm not going to worry about antacids. Oxazepam or Seraxate is a moderate to short to intermediate acting benzodiazepine. The reason it is chosen because it is the only benzodiazepine that is not metabolized by the liver, so it's safe to give to them. They have a pretty decent dose, 15 to 30 milligrams, 3 to 4 times a day for their agitation. And you're trying to prevent them going into delirium tremors or DTs. Side effects are headache, dizziness, and vertigo. So I said we weren't going to cover much right into osteoporosis. I've also limited what drugs we're doing for your osteoporosis. I gave you your CARCH pages and table number, your calcium supplementation, and then you can be treated with calcitrol, which is actually a vitamin D. It's a synthetic vitamin D. Side effects are hypercalcemia, so you're going to monitor your calcium levels. It can cause renal toxicity, so you're monitoring your creatinine level. It's contraindicated if they have a history of ventricular fibrillation, metastatic bone cancer, renal calculi, stones, or of course hypercalcemia. Major side effects are drowsiness, weakness, fatigue, headache, nausea, vomiting. Your biphosphonates, your alendronate is on page 625 of CARCH. Another panhydrinate, which is another one, but just the dronates are your biophosphonates. You want to look over your nursing considerations in CARCH, page 623. The biophosphonates or alendronate will inhibit the bone reabsorption. It needs to be taken on an empty stomach. They need to sit up for a minimum of 30 minutes after taking it. It can cause diarrhea and headaches, nausea, vomiting, mainly GI symptoms, abdominal pain, can cause esophageal irritation. You don't want esophageal erosion from the alendronate. So full glass of water and sit up for a minimum of 30 minutes. Cannot be taken more than 5 years because at 5 years they have an increased risk of femoral shaft fracture. Okay, that's the only parts I'm covering on here. We're going to go off on relieving pain. We'll go into just over-the-counter anti-inflammatories, and you should be familiar with NSAIDs. Okay, so your thyroid. Hyperthyroid, we're just going to talk about the radioactive iodine. Pearson covers this on page 865. I gave you the numbers for your CARCH. Look over your nursing considerations, page 617 of CARCH. When they're taking the radioactive iodine, they don't have to be on any radiation precautions. It's contraindicated in pregnancy because it crosses the placenta. Of course, there's also the risk of developing hypothyroidism. That's the most common adverse effect. So if they get hypothyroid, they'll have to be on thyroid hormones the rest of their life. So you will watch for the symptoms of hypothyroid where everything is slowed down. So fatigue, mental fatigue, memory problems, hair loss, dry skin, constipation. Also, some other adverse effects are thyroiditis and cardiac instability. They should be taught to monitor their heart rate, and they need to call and report if their heart rate is greater than 100. Some other possible side effects are a metallic taste, burning in the mouth, sore teeth and gums, diarrhea, cold symptoms, upset stomach, skin rash, stained teeth, and goiter. Told you I'm just going to keep moving here. Hypothyroid. The only one we're focusing on here is your levothyroxine. I gave you the pages for your CARCH. Look over your nursing considerations, page 613. In your Pearson, it really doesn't discuss it, but it's on page 871. In your CARCH book, really good for your side effects for hypothyroid for levothyroxine is figure 37.3. It is metabolized in the liver. Adverse effects are signs of hyperthyroidism, which is revving everything up, palpitations, tremors, headache, nervousness, increased heart rate. You need to teach them to take it on an empty stomach. It's many medications block the absorption, so don't take it with anything else. Take it with a full glass of water to try to prevent esophageal atresia, and which would lead to trouble swallowing. Drug interactions. It increased the effects of anticoagulants, so they may have to be on a lower dose of the anticoagulants, such as Coumadin. And it decreases the effect of digoxin, so you have to watch the digoxin levels and monitor effectiveness there. Okay. And that's the end of this. Oh, I thought I combined them. I'm sorry. I'm going to go to the other one and finish recording.